Hello, my name is Dawn Julian, and I'll be your instructor for Management and Leadership in Nursing and Healthcare. This is a graduate level course for Oklahoma Wesleyan University, Nursing 6313. I decided to tape a short video just to introduce myself and to tell you a little bit about the course. But all the information I'm going to be providing is in your syllabus and in the course materials in your textbook. I certainly want you to contact the instructor or email me if you have questions about any of the assignments throughout the course. If you do have questions about any of your grades, send me an email, and I'm also available by telephone. My phone number is 785-317-0188. I do like you to use the Contact the Instructor section if you have questions about the assignments first, if possible, because my answers might benefit other students in the course as well. I thought I would take just a few minutes to read the course objectives, because I think this is very important as we start a new course. As an adult learner, you'll be able to evaluate the impact of evidence-based practice, education, and quality measures on accountable care organizations. The second one is to create nursing frameworks and innovative change to promote healthy work environments, nursing satisfaction, and quality patient care. Third one is to determine a change theory that promotes positive organizational outcomes. Fourth is to compare and contrast strategic marketing plans, business plans, and staff resources. And finally, examine strategies for developing a culturally diverse and highly functioning nursing work environment while increasing nursing satisfaction. So there's a lot of key words in the objectives. Things like accountable care organizations, quality patient care, nursing satisfaction, marketing plans, a change theory, and culturally diverse workplaces. So we want to keep all those things in mind as we go through the next 8 weeks. You will be doing applied learning practicum, and you'll be turning in a log in weeks 2 to 8. The practicum is about your leadership abilities. So you'll learn a lot about yourself and about leadership as you're working on the practicum. I'm not going to go into a lot of details at this time, so you can have a chance to read everything and see what specific questions you have. The course textbook is Management and Leadership for Nurse Administrators. And it does have, you should have an online access code for some additional student resources. I also recommend that you use the publication manual of the American Psychological Association. I'll be using this when I do track changes on your papers so that you continue to use APA format for your academic writing, and which you'll also use in the future for professional writing. Some students also like to use the Pocket Guide for APA Style by Perrin. Now, this particular course will involve a learning team, and the area that your learning teams will be working on is generations. And the learning team project will be due in week 7. I will be dividing up the class into 2 groups at this point. Right now will be 4 students in one group and 5 in the other group. This class also involves a scholarly paper almost every week, and you'll find when you do the research for that, you'll learn a lot, and you'll be able to synthesize the information and write a paper. In the syllabus and in the grading rubric, it specifies how long some of the papers are to be or what should be covered. So you'll need to follow those instructions very carefully. If one of the criteria is to cover a certain point and you leave it out, I'm not able to give you points for that section. So no matter how outstanding the rest of your paper is, make sure you cover everything that is required. The papers are going to be on topics like the first week complex adaptive systems, and I find that very interesting. When I applied to get my DNP, I had to take as a prerequisite a class on complexity theory, which includes chaos and complex adaptive systems. That was one of the prerequisites for my DNP because it had been a number of years since I'd gotten my master's degree, and that had not been really something that we'd covered earlier. The second week, your paper's on theory in professional practice. Third week, it's on leadership. The fourth week is on interview, where you interview a nurse educator or administrator. The fifth week is an annotated bibliography. The sixth week is on assumptions, and the seventh week is on androgyny versus pedagogity. Well, you know what I mean. I always have trouble with that. I do not have examples of the paper. Sometimes students ask for that. The curriculum is new, and this is the first time I'm teaching the course. I do have a problem. I usually do provide an example if students ask, but I do not have any. Plus, I sometimes think that limits students, and they think they need to write exactly like the previous student wrote. But as long as you follow the rubric and cover everything, I think you'll do very well with the assignments. The discussion questions, there are 3 each week. One's a discussion question, one's an educational discussion. The first week, the first one is on interdisciplinary collaboration, and the second discussion question is on evidence-based practice, and there's always a spiritual life discussion. I do use the grading rubric for grading. If you do not submit the correct number of or post the correct number of responses, you'll get points deducted for that, and there is a deadline that you're supposed to do your first posting. I also do look at the word count. If you're responding with 1 or 2 sentences, it's probably not substantive and probably would not count towards the points in the rubric. Also, for references, I like you to have 1 or 2 references with your initial post, or as many as you want. But the rest of your posts for each discussion question, I like you to use a reference with at least one of those responses. You don't have to do one with everyone, but I do like to see that you have used other sources. And you write the reference at the end of the post, but be sure to indicate what section or what sentence you paraphrased or quoted in the post. Don't just write a reference down at the bottom and without indicating what section was paraphrased or quoted. Just to give you a little bit finish up with my educational background, I did go to the College of St. Scholastica in Duluth, Minnesota, and graduated in 1977. So I've been a nurse for almost 40 years, and I'm certainly glad that I made that decision. I work full-time in a wound clinic as a APRN provider. I do ostomy and wound care, and I also do consults in the hospital. And I also have my doctorate and master's degree from the University of Kansas, and my doctorate is in organizational leadership. My master's was in nursing education and adult clinical nurse specialist. I am board certified as a nurse executive advanced and as a certified nurse educator. I will look forward to reading your introductions, biographies, and have a great week.